Hey, well, welcome everyone. It's the top of the hour, so we're going to get started. My name is Bridget Dolan. I'm the Executive Director of the Good Times Project in Seattle, Washington. I'm happy you're all here this evening. We are excited to welcome Dr. Tracy Gaslin and this session called Camping in COVID Times, Effective Health and Wellness Measures. Tracy Gaslin is a dual certified nurse practitioner with a doctoral degree in educational and organizational leadership. Dr. Gaslin treats patients with bleeding disorders and is the executive director of the Association of Camp Nursing, a member of the National Association of Pediatric Nurse Practitioners, a volunteer for the American Camp Association, and is on the editorial review board for the Intravenous Nursing Society. She publishes most of her work in the areas of camp nursing, service leadership, and pediatric development. I'd just like to welcome Dr. Tracy and thank her for being here. And as Matt said, please do stay on because we will have an attendee poll at the end. So with that, I'll turn it over to Dr. Tracy.
Thanks so much. It's always a pleasure for me to be with my COCA friends. So great to be here, even if it is like 8 o'clock at night. Y'all are hardcore late nighters. I give you kudo points for this. So I'm going to share my screen here and just kind of share with you a little bit about what we've been doing. As you all know, we've gone through summer 2020. We had camps that opened, camps that did not. And we have done some intensive research following that experience. And so I want to relay to you some of those research findings, some of this preliminary data that we're pulling together, which has been very interesting. Some of it reaffirming, which has been always a nice piece to have after the fact. And then we also want to kind of talk about what things were done this summer and what that looked like moving forward. So each week I'm giving presentations weekly, multiple times a week. And as we get new data and as we continue to dig into the information, I add to this presentation. So what you're getting to see tonight is more information than the folks got to see last week or 2 weeks ago. So we'll just keep growing that and hopefully providing everything we get our hands on as we go through the next fall and the spring. So basically, this is what we're going to talk about for the next little bit. What was done, what worked this summer, and then how does that impact all the future considerations? So at this point, most of you all are probably considering summer 2021. What does that look like? It's a different world, obviously, especially for special needs camps, camps as yours that serve immunocompromised children. So there's a lot to consider as we think about summer camp next year. I wanted to share with you some of where we're collecting evidence. So since camp ended this summer, we've done several things. We've sent out a quantitative survey to healthcare providers and got a nice response from those individuals. We've done some really in-depth qualitative interviews of camps that operated this summer and got a lot of rich data to kind of reaffirm and support the quantitative piece. We've reviewed over 8,000 health log entries. So we queried health log entries that mentioned COVID, coronavirus, illness, and really looked at the type of things that were presenting to health centers. And then ACA just finished up their business survey, which also asked some COVID coronavirus questions, but we have not had a chance to really dig into that data as of yet. We're very excited to do so, hopefully soon. So some quick early data, things you may know is that this summer, about 30% of camps opened, about 70% closed. Of those 30% that were open, most of those were day camps. And the reason being is that day camps in some states were considered essential services, meaning they needed to be open so parents could go to camp. So we're seeing kind of the expected break that we did. This was what we were looking for and expecting when we were talking to camps this summer. The data says one of the questions we asked were reasons for closing, and over 70% of the camps that closed said they did so because of either state regulations, meaning their state did not allow them to operate, or there was a significant change in their camp culture. There was also a variety of other reasons, but it was pretty interesting that the majority of camps, more than 70%, fell into these two categories. Obviously, camps like that COCA support are those high-risk immunocompromised populations, And there were also some other random pieces around MPIs and financial constraints. Here's some quick data that we got from the COVID interview experience. So this data really looks at a comparison of 2019 and 2020, how many campers were served in 2019 from these camps that were interviewed, and how many were served in 2020. Obviously, you see in the graph on the left that everybody served smaller numbers of people this summer. Even if they were open, they tended to decrease the number of kiddos and staff that were on site. The graph on the right really outlines the weeks of camp by residential and day. But the two pieces I really like to look at are those last two, where it talks about COVID positive staff and then COVID positive campers. What we have found thus far is that day camps have done really well in the COVID world. Hardly any staff with COVID positive in day camps, and very few COVID positive campers that went to day camp. The majority of COVID cases have been found in residential experiences, and most of the ones that did have COVID cases were ones that decided not to use the full cohort of NPIs. And we're going to talk about those in just a minute. One of the questions we asked was, did you require COVID testing prior to camp? The majority of camps did not require testing of staff or campers, primarily for the reason that they didn't have access to testing, right? It's hard to believe that just a couple months ago or 3 months ago, you couldn't get a test. And now you can, pretty much any of us, for no reason at all, can go get tested in our local area. So it is a dramatic change we're experiencing now, but this is what the landscape looked like before camp. We also ask about COVID screening, and we're going to talk about this a little more in a later slide. But we talked about screening and quarantining. We found that most every camp that opened this summer did some type of symptom monitoring. They had a tool or mechanism to monitor symptoms before camp started. They also, majority of camps asked people to self-quarantine, meaning 7 to 14 days before the camp started. They asked staff and or campers to quarantine during that period in an effort to really arrive to camp in a healthy state. Here's where I want to spend a little time with you so you can understand what happened this summer. NPI stands for non-pharmacologic interventions. The top blue dots are all of the NPIs that we recommended, that we discussed early on, that camps should try to apply to their camp experience. The brown dots are really how camps translated that to their camp. So for example, when you look at the screening category, camps did a variety of things around screening. Many camps, as we mentioned earlier, did a pre-screening period, 7 to 14 days, having staff and or camper pre-screen before they come to camp. We did not think that that experience actually was a way to capture COVID cases. The whole intent of pre-screening was to really raise awareness of staff, raise awareness of campers and families, so that when symptoms did occur, if they were to, that we were able to recognize that and respond to that early. So most all camps did some form of pre-screening. There then was initial screening when people arrived at camp, which is something we all typically do in some form or fashion anyway. Throughout camp experience, camps did ongoing screening. Some camps checked temps every day. Some did a symptom monitoring checklist every day where they had the counselors ask the kiddos how they were feeling. And then some camps even went as far as to do a post-screening. In other words, when the kids left camp, they asked the parents to monitor their children for another 2 weeks. And if any symptoms presented, they wanted to know, with the potential if they were exposed at camp, they wanted to be able to share that and do good contact tracing. We talk a lot about hand hygiene, and we still reinforce that, mostly soap and water and sanitizer. We know that people are better with soap and water. We know that they get better coverage of their hands with soap and water. The challenge with hand sanitizer is that we squirt a dollop in the middle of our hands and we wash our hands together, but we don't often get the fingertips really well. And that's the critical piece right here. So when we talked to camps opening this summer, we said, we want you to actually go in and teach hand washing. And they're like, really? We're like, yes, we want you to teach people how to wash their hands with sanitizer and with soap and water. and make it a fun activity. Make it just part of your curriculum for the summer. We asked people to do face mask. Some camps translated that to cloth face mask, and they asked campers to bring one for every day. Some used cloth face mask and they washed them every evening. Some provided a disposable face mask daily for everybody on site. Everybody did something a little different around the face masking. And many of the camps decided with some intentionality around when and how those face masks were worn. One of the most prominent things done this summer was cohorting. Of course, camps didn't call it cohorting. They called it being in their pod or their family or their village. And those pods, families, and villages typically were anywhere from 8 to 15 children, and usually a couple staff involved in that number. So those numbers, as a general rule, connected at the very first day of camp and traveled throughout the camp experience together. They did everything together. The beauty that came out of that experience, when you initially thought, oh man, I can't be with my friend, or I'm not with the people I'm usually with, what we learned was that these kids had more impactful, more powerful experiences really connecting to a very tight group of people than they would have ever had before had they been allowed to navigate and free flow in different ways. So we saw a lot of really good mental health stuff coming out of this cohorting piece. Sanitizing, we know it was done more frequently in all high touch areas, but that was defined different ways for different camps. How they defined frequently may have been daily, twice a day, every other day for different regions, but everybody did high touch areas, right? The dining hall tables, the doorknobs, those were their areas of focus. What we're learning, in essence, because we're not finding any new research, is that we don't think COVID-19 is as risky of a transmission by fomites. Fomite is what's left on the tables and the high touch areas. That the risk of getting COVID-19 is not as significant from a fomite transmission as maybe we originally thought. One of the other beautiful pieces that came out of the summer was ventilation. We talked about this a little bit in April, May. We said, ventilation is probably a good idea. We don't really know for sure. But ventilation means, many camps moved everything outdoors. Many camps put fans on in their residential areas. They opened the windows and had screens so air could blow in at night. What we have learned thus far in our preliminary data is that every camp that took everything outdoors, health services, feeding people outdoor, playing outdoor, had 0 cases of COVID, right? So we know that ventilation, that ambient air movement, the fact that we naturally space out more when we're outdoors are great incentives to kind of think about how you retool your camp experience so that you do as much outdoor as possible. Physical distancing was the last one. We knew going into the summer that was going to be the most challenging thing to do. We are human beings. We are relational. We want to chat with one another, with friends we haven't seen for a year. And so physical distancing we knew was going to be hard. But in the context of doing all these other things with that, we found no real significant challenge with the physical distancing. We know camps did a lot of really cool things. They spray painted their grass to keep kids in certain areas. They put duct tape in certain areas. They didn't want people to sit too close together. They staggered their meal times so people were able to space out more. Or they fed one group outside and fed another group inside. So they got really creative about how they just kind of distance people without having to walk around playing distance police, right? So they said, okay, you're the yellow group. You're going to stay in this yellow spray painted area on the grass. Or we're going to feed the guys outside on this day and the girls are going to eat outside the next day, and the opposite days they could spread out in the dining hall. So really some creative ways. We're going to talk about more of that as we go into the next slide, but I want you to get a sense of what happened this summer. We asked about frequency of use of all the NPIs. We said, how much did you use them? 5 meant they used it always. 1 meant they used it never, right? So if you look, the top thing was cohorting, small groups, how important and impactful that was to help manage the risk, right? So people came together, they were put in their small group, small cohort, 8 to 10, 12, 15 people at the most, and they traveled the camp experience, right? And then you can see the numbers throughout there. When you get down to face masks for campers, you go, wow, we didn't do so well on face masks. I just want you to realize that camps intentionally design their experience this summer so children could have their face mask off at designated times. So that's why camp people responded to this question with, hey, we did put masks on them, but they weren't required to wear them all the time. Campers in most situations this summer were not required to wear their mask when they were doing water activities, when they were eating, and when they were in their cohort. So when they were within their group, many times the camps allowed campers to have their mask off. So those were intentionally designed that way for the benefit of the camper. We asked some other questions on our survey this summer. One of the questions was around mental health. What did mental health look like this summer for your staff and for your campers? A resounding note about campers was they were resilient. They were wonderful. If you told a camper to put their mask on, they said, okay, I'll put a mask on. If you told the camper to space out a little bit from the friends, they spaced out. Kids were just truly excited about being with their friends this summer, right? They were willing to do all these things that we might think be near impossible to get kids to do, and they were just resilient through it all. The mental health challenges were your staff. The staff were the ones who were more anxious about what was going to happen when one of their kids coughed, or what if one of their campers had a runny nose. So staff required a little more direction, a little more education, a little more support. There were one or two instances where staff physically left because of their anxiety level around the experience. But for the most part, talking through it, debriefing with one another, communicating well, staff were able to kind of come along, really buy into using the MPIs and being really good role models. We asked a question about illness this summer. How much illness was at camp this summer? Because we all typically have some illness, right? Pervasively across everyone that was interviewed and asked in the survey was, we had next to no illness this summer. Many camps said we had no fever, we had no GI symptoms, we had no respiratory issues. And therefore that tells us that those NPIs, when done well, work really well. That it's not just COVID we're protecting people from, we're keeping them healthy across the board from all the other things that we traditionally have to deal with, right? So camps dealt with a lot of ears because kids were in the water a lot this summer. They played a lot of water activities. It was hot in Texas, so they were outside and they were doing sprinklers and water hoses and pool activities, and so they did a lot of ear treatments and external otitis externa this year. So, but for the most part, illness was not an issue. We then asked a question about health services. Did they have to change their health services? And camp said, yeah, we changed some of those things. We changed things that prevented people from grouping to the health center. And I'm going to share some of those with you in in the next slide, I think. Yeah. So here's some creative things that were done this summer. And I'm telling you, I love camp people because so darn creative. Many of the camps created health services tents. They moved all their health services outside. They put a tent up. It had open sides, so there's free flowing air through there. They were able to triage kids outside who may have presented with some symptom. They were able to treat first aid, do minor injury. They were able to do all kinds of treatments outside, all kinds of things that allowed for that ventilation piece to be working in their favor, also for some easy distancing. And then the camps that didn't have space used their health center for their isolation area. So many camps that moved their health services outside underneath the tent said they loved it. So they don't know why they didn't think about it before now. They're going to always keep their tent. We wanted to hear those answers about what did you do this summer that you said, it was so good, we're going to keep it. And that was one of the things that nurses and healthcare providers said, we really liked being outside. We liked being where we could see the kids playing. We liked feeling more engaged to the population and the experience. So I thought that was very interesting. Most all camps did a drive-through check-in process, meaning parents were not allowed on the camp. Now I will tell you, the nurses loved it. They had to do more pre-work. It means they had to call the families ahead of time, check on the meds, make sure that everything on the application was still current. But when the car rolled up, They took the child's temperature before they ever got out of the car. They rolled the window down, took their temperature. If they were afebrile, the kid felt good, had no symptoms. They got out of the car, they came into camp, and the parent left. So the drive-in check-in experience obviously dramatically decreased the amount of time they spent on that first day check-in experience. And most camps said, we loved it. If there's a way for us to keep it, we're going to keep it. It was so much more simple than what we'd historically done, and having these very time consuming, difficult first day experiences walking through everything. So drive-through check-in was a big change. Hand washing stations. You'll see two examples of pictures above. Here's one where somebody took an old door, they cut a hole in it, they stuck a sink in the hole, they connected their water hose, they had soap and water, and boom, they had a hand washing station. Very cheap, probably didn't cost them anything. The one on the left is a portable hand washing station. The nice thing about these is that you can put them anywhere that you have a water hose access. The part you can't see is that they have a foot pump. And so the foot pump is what produces the water. Kids loved them. They thought they were another activity. They splashed each other with water in the hand washing stations. They washed their hands a couple times just so they could stand there and have access to the water and pump the pedal. So camps talked about these portable stations, and that many camps got 3, 4, 5 of them and just put them everywhere all over the camp that they had water hose access. So it was a very nice way to kind of provide that additional hand washing opportunities. Other people used canoes, created hand washing stations for multiple people, just a variety of really cool ways to do that. Camps then thought about how to do screening. And this pre-screening, which we talked a little bit about, from 7 to 14 days before arrival, can be done with a paper format where you have staff and or campers fill out a form, take their daily temperature, monitor their status. Some camps went as far as to go ahead and use technology for their screening. And there was some significant benefit to that. And here's what they did. They used an app. There's a couple different apps that they used. And the app allowed the individual to put that information that the camp was requesting in the app. And when they hit the send button, that information went that day to the camp. And on that day, which may be day 2 or day 3 of them self-quarantining and monitoring their symptoms, the camp could see what's going on with them. If there was any symptom or anything that raised a red flag, the camp could call right away and say, it looks like you're having a cough. We'd like for you to go to your primary care and have that checked out before you come to camp. And we have a plan to show that shows that you're arriving healthy, right? So getting that daily data was very helpful to people because they were able to address things early. They were able to know that people were actually checking every day instead of waiting till day 14 to fill out the whole form before they bring it to you. So they knew they were actually checking every day and putting that data down and giving that to the camp in a kind of very effective way. One of the last things they did for health services is that many health services went to the campers instead of the campers coming to the health center. They got a golf cart, they slapped a piece of duct tape on the front of it that says mobile health clinic, and they went out to wherever the kids and the pods were. So they kept the cohorts where they were, and the health center staff went to them. They treated their small injuries there. They treated, they could triage within the cohort. That was a nice way to kind of, again, keep people separate if they need to, in case there was an illness concern within a group. So these are some examples, but all ways that camps were very creative in thinking about how to apply those NPIs within the context of their camp. I can't reinforce enough, and I think you guys know this as well, that you need a plan for camp, and that plan needs to be a very well constructed, thought out, communicable disease plan. And within that plan, you address all of these 4 pieces, right? All of the NPIs that you have in place, how that's going to apply to your particular camp, supplies and resources. Then, of course, how do you manage an outbreak? How do you manage that COVID suspect or that person who just presents with illness? What does that look like, and how are we going to manage that at our camp, right? And then the last piece is communication and debriefing. I could spend a very long time talking about this one topic, but I know I don't have that kind of time. We are going to do a communicable disease planning workshop in January, and we're going to spend 3 hours. And I'll be glad to send that to Jennifer. She can share it with you all to say, hey, if you're interested in this, you may have a plan and you want to just make sure your plan is up to snuff. or you may say, I've started a plan, but I'm stuck. So we'll be glad to help you along the way. That's a really big piece of what ACN wants to do to make sure camps are ready for summer 2021 by having their CDP ready to go. These are resources. There are lots of resources out there. You've been inundated with resources, but I point these three out because they're what we call living resources, meaning they're constantly being updated. They're constantly trying to keep up with what the most current information is. So obviously the CDC has information. We were feeding them all kinds of information in April, May for the field guide and to get their guidance out to make sure we could get camps up and running that wanted to open. So CDC has, of course, an array of information, and now they're waiting for us to get our data done to send it back to them so they can now use that for school openings. So we're working kind of very closely trying to make sure we're sharing data back and forth to help people set up things in the most effective way. Then you have ACA, their resource library is constantly being updated. And then the campnurse.org, which is ACN, also has our COVID and coronavirus page. It's constantly being updated. The field guide is on the ACA and the ACN website. So if you've been doing any research, I hope you have found that document. It's going to be hugely helpful for you guys moving forward. This is just a snapshot of the field guide. If you've not seen it, there are several chapters. It goes through all parts of COVID preparation, communicable disease work. We have worked really hard pulling all of these pieces together. We had environmental health and engineering, EHE, kind of pull the pieces together as we collected the data and information to share with them. So we feel like it's a really nice working document. We just updated it again in October. I think we'll be having another update in January, probably late January, with more information. The most recent update are these last two chapters, chapter 12, which outlines technology and controls, and then chapter 13, which talks about medical testing. And so really this will be the year that we have the opportunity, we didn't really have it in 2020, to think about testing as another NPI, right? Another tool in our toolkit to think about ways to help people arrive to camp healthy. What we don't want to happen still at this point is for people to get too comfortable with just doing a test, because a test is only a test for that very moment that you're doing it. That result is only that result for that moment. It doesn't mean you're not going to be different tomorrow, all right? So we have to be very conscious of that, but it can be another tool in your toolkit. We talk about, this is the chapter 12 in technology. I just pulled you out a quick snapshot. This chapter really talks about all of those NPIs that I just outlined for you on a previous slide. It talks about putting them in different categories of containment, really. So you have PPE at the base, then administrative controls are all those things we can do to kind of target distancing, cohorting, how do we do contact tracing? And then we can engineer our camp spaces, right, by doing different things to create the NPI influence. We can do things like spacing people out, adding ventilation. Many camps added all kinds of ventilation in their sleeping quarters and their activity buildings, hand washing. Then the substitution piece is around what did camps do differently, or what should you consider doing differently? This is the part where the culture piece, remember I told you early on, some camps didn't open because it was changed their culture too much. It was because of the substitution piece. Some people said, no, this is what we do. We don't want to change that. So we prefer not to open than to have to change significantly and substitute something else for an activity that's kind of just who we are. So substitution really looks at how do we substitute activities? How do we do things differently? How do we change our schedule around? All of those pieces. And then of course, elimination. How do we eliminate as much risk as possible? And we do that by screening, keeping people at home when they're sick. And then of course, testing is being added to that. Chapter 13 really starts to dive into the medical testing, right? So we have testing, PCR, antigen, antibody. None of them are great yet. None of them are great, and I still keep adding the word yet on. PCR and antigen really give you information about active disease. Antibody tells you if someone has had the condition. But all of them still have somewhat of a low sensitivity. meaning we may be missing people who are actually positive. So the PCR antigen are really looking at their viral load. So it's all about timing when you test people for the active disease. If you test them too soon and their viral load is not high enough to be detected, they're still going to look negative, right? You test them too soon. You test them too late and their viral load's coming down, you again may get a negative result because you don't have enough viral load to identify that. So testing is intimately tied to timing. The same thing happens with the antibody test, right? Antibody test, if you test them for an antibody too soon, they may not have built up their IgG, IgM antibody response. If you test them too late and they had a mild reaction or they don't have an immunity built up, you'll also not get an accurate response maybe. So this is a very kind of difficult situation in that it does give you a point in moment. We still know the PCR in essence is gold standard, but it's not a great gold standard. So just think about that. I really encourage you to look at this chapter. I think it gives you really good information about how do I think about testing in the context of all the other MPIs. That's really what that chapter is about. How do I think about testing? And if I think we want to do testing before camp starts, when do I do that, right? What does that look like within the context of quarantining and pre-screening? And do we want to add a testing piece? Maybe, but you need to really have a good, well laid out plan around how you do that. And this chapter will give you some early support and help in that. I always like to make sure you're thinking about future considerations. And of course, this slide continues to get exciting for me. Of course, after we hear Pfizer's news at the end of last week that their vaccine is maybe 90% effective, that makes us a little excited that there could be something coming out. We know Moderna and Johnson & Johnson are both heavily moving forward as well. Their clinical trials seem to be having good results. I bring this up to you because obviously if a vaccine is approved, I can feel pretty confident in saying to you it's not going to be available to kids for summer 2021, only in the rarest of situations. It's going to start, if it gets approved, the dissemination starts happening. It will start with geriatrics, nursing home patients. It will move to healthcare workers and first responders, right? And then it will typically move chronologically down to the age range. What we're working on is getting, hopefully working on is getting counselors, camp counselors, to be classified as a child care worker. And what that does is child care workers then get put up in this category with healthcare providers and first responders and get earlier access to the vaccine than others. So in the perfect and great world, your staff could maybe get vaccinated before summer, right? And that would be a huge help to all of us if our staff were vaccinated before summer, or at least have had one, depending on what the series is going to look like. So food for thought. I want you to be thinking about it. We still don't have answers. If it's approved, if we have access, is there going to be folks who will be unwilling to take? You all in your particular population of kiddos will have to think about what is your immunization policy, what do you want staff to be required to do versus your campers. So just kind of have a little thought in your head around your immunization policies, how they might be impacted, because if we get access and information, it may be March, April that you're having to really kind of think about this more consistently as you walk into the summer season. So to summarize, here's the things I want you to walk away with. Your communicable disease plan is essential. Campers are resilient. As hard as we say, you know, kids aren't going to do what you want them to do, they will do that. We have learned this summer that kids really will do what you ask them to do. If that means they get to stay at camp and be with their friends, that's exactly what they're looking for. Your bigger challenge is preparing staff. So if you're thinking about staff education, staff training, staff preparation, think about what are those things you need to tell them so they get a really good understanding of how camp is going to look this year. Things like, will the staff need to stay on camp always? What will be their requirements for NPIs? What kind of mentoring are you going to be expecting? We already expect a lot from our counselors at camp, right? So it does create a little more responsibility and accountability on their part. And we really want to try to do as much preparation ahead of time as possible. Partner with your public health folks, wherever your camp is. Please call those folks soon, 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 and say, hey, we're an oncology camp. We're planning to operate summer 2021. We want you to be aware. Every state and every even local area has different requirements by their public health folks. Some want to see your communicable disease plan and sign off on it. Some just want a copy to keep in their file room. Some don't want to see anything. They just say thank you and thank you for letting us know you're here. Every place will have a different expectation, but getting that and understanding that now is going to save you a lot of headache and heartache the closer you get to camp. So just partner really well and be very proactive about communicating with them. And then just continue to learn. These things we're doing right now are important. When I do this presentation again, I'm sure in December and in January, I'm going to have a little more and a little more information. So just keep seeking information and keep looking and keep reading, because obviously it's not going to be an upside down turn, but things will change, and they will continue to get more data to support our recommendations moving forward. Here's my last slide, and I always like to end with this slide. When we did our interview, we asked 3 questions. The last 3 questions of the interview were this: did you feel like Camp 2020 was a success? Second question, did you feel Camp 2020 was safer than Camp 2019? Third question was, did you feel Camp 2020 was healthier than 2019? And these were our responses. It didn't matter if the camp had no COVID or 50 cases of COVID. Every one of them felt like camp was such an important experience for kids to have this summer. So it was just really reaffirming that these camps stepped up, kind of learned the early pieces, really are providing great data and support right now as we work on guidance for you guys for other special needs. I'm working with the Serious Fund Network, creating their guidance for the summer right now, trying to figure out what that looks like for all of their populations as well. And just really talking about the value of camp. Yes, we want to keep kids physically safe, but the emotional benefit is so immense as well. So let me stop there and see what questions you guys might have.
Tracy, there was a question put out, excuse me, in the chat regarding the apps that you were referencing early on. If you could touch upon, if you have any specific ones.
So there were 2 that were primarily used this summer. One was called ProCare Connect, and the other one was called Airtable. ProCare Connect is basically initially designed for schools, and so you have to go in there and do a little tweaking to create your own kind of survey in that app. Airtable is basically a creation type of app. So you go in and you create, that's the whole purpose of Airtable, is that you create your own tools in there, right? So people did both. I've been playing around at Airtable a little bit. I think it's pretty easy, and I am not technologically inclined, so if that tells you anything. So I'm sure they both work fine. If Airtable seemed a little more flexible for me, seemed a little more intuitive for somebody who's not great in the technology world, but either one should work. And it's a great tool to kind of say, if we're going to do pre-screening, then let's make sure we're getting that data in a timely way so we can make early decisions, and so we can make sure people are actually doing this every day, right? Because you're always going to have some who want to wait till day 14 to fill out the pre-screening form and bring it with them. Unfortunately, there will be some of those always. So this is a kind of a great way to hold people accountable and make sure you're bringing people to camp in the healthiest way possible.
There's another question, Tracy. Did you hear about any camp that asked for a firm 14 days quarantine to staff, volunteers, and/or campers, or was it mainly providing advice to reduce their contacts the weeks before?
Camps were asking their staff and campers to quarantine for 14 days. They were kind of saying, here's what we need you to do before you come to camp. They were sending out their symptom monitoring tools. They were asking them to fill those out and bring them with them if they were using a paper form. So, and many camps said, because of where we are, because of the current state of things, we just don't feel like we can bring people, have a sense that we're bringing you to camp healthy without that information, right? So in essence, most of them did do some. Now, some did it for 7 days before, some did it for 14, but I would say the majority probably leaned toward that 10 to 14 day range.
How do they do quarantine for healthcare workers? Did that mean like you could go to work but wear PPE the whole time, or did they expect people to fully quarantine?
Yeah, healthcare workers kind of got a little bit of a slide, right? Because you can't tell them not to work. But for the most part, we feel like healthcare workers, obviously many camps said, we don't want you working in a COVID ward and then coming to camp, right? If we can avoid that. But if you're working in your traditional role, you're wearing PPE and using all of that equipment effectively, then basically they just ask them to monitor their temperature, monitor their health status before they come. And then when they got to camp, healthcare providers are pretty much the ones that wore masks all the time because they crossed over all the cohorts they interacted with. So they wore their face mask and their gloves pretty much when they were doing any kind of care, for the simple fact that they were one of the few people that interacted with all the different smaller groups.
So here's another question, Tracy. Do you know how many camps that had in-person camps served the oncology population? Also, what are your thoughts about traveling by planes to come to camp? Would they need to quarantine or test post-travel?
I don't know of any oncology camps that operated this summer. I mean, I think people you all may, but I don't know of any special needs camps that operate this summer. And I've kind of asked around. I mean, I know none of the Series Fund operated. I've asked several of the other special needs camps, several oncology camps, several of the camp qualities, so not operated this summer. And that was probably many states just made very strong recommendations that you shouldn't be serving that population of folks who are immunocompromised in group and community-based settings. So in relationship to the travel, bus and airplane, right? Those are both questions that I get pretty consistently. People do travel by airplane. Right now, the airlines are doing a really good job of sitting one person per row, wearing your mask, screening people before they get on the plane. So at present, they have air flowing in the planes. They have their vents open. So at present, planes are actually seem to be pretty safe. Every camp can decide, of course, what they want their individuals to do. So if they've quarantined and screened themselves for 14 days, they hop on a plane, they come to your camp. You may decide to do a test, right? You could decide to do a test before they get on the plane. You could decide to do a test when they get there. It really is, some of that's dependent on how quickly you can get that result back, for one. But if you do have someone who flies and you test them the next day, the chance of feeling like they got COVID on a plane, you're probably not going to catch that. I mean, it's just, someone encounters someone, and the way we know that COVID continues to be spread is respiratory droplets, contact with another individual for what they call an extended period of time, which is 15 minutes or more, right? So if Matt and I meet up for lunch and coffee and we're not wearing masks and we're sitting closer than 6 feet and either one of us has symptoms, then we could be an exposure if one of us has COVID and we give it to the other, right? But the risk of you getting some of that in passing, or when you are wearing your mask and washing these things really well, your risk goes down significantly. So the key is to not only think about a test, but think about, make sure we get all those other MPI training pieces in place, right? Tell the person who's flying, here's what we want you to do. But right before you get on the plane, we want you to wash your hands. Or when you get on the plane, have your hand sanitizer, wash your hands. Don't touch anything except your personal items, right? You can give as much direction as you want to around thinking about all the other NPIs. Because the whole goal here always is using all the different NPIs you can use in whatever structure or framework that is. If you're going to do a residential camp and you've got people sleeping together, right? We're going to think about how do we ventilate that area? How do we get people to hand wash well? When do they take their mask on and off? How do we space them out? What are all those things we can do to help mitigate that risk? And it's never just one thing. It's always thinking about, okay, this is my hand. If you think about cards, these are all my cards I've been dealt, all my NPIs I have at my disposal. Now, how do I use them in the different activities, in transportation? How do I use as many of those as I can to get people traveling safely or on camp, keep them safe? The same goes for busing, right? So what we've learned about busing is that when you put people on, we screen them, we wash their hands, we put them on the bus, we set one person in each seat, unless it's siblings and they can sit together. And then guess what we've learned to do? We open the window about 2 inches and air flows through the bus. And we've shown that that's greatly decreased some of that respiratory droplet potential. So that's another piece we've learned about over the summer, is creating ventilation wherever you are is significantly helpful.
If anybody else has questions for Dr. Tracy, feel free to put them in the chat, or if you're comfortable unmuting yourself, feel free to ask.
I was just, when you were talking about transportation, it just made me think about some of our around camp transportation, like our people movers and our golf carts. And I mean, obviously they're open air, but just by virtue of the space, you're closer together.
Yeah, you can always think about, like if you're using golf carts to transport kids, can they sit in the back and the driver sit in the front, right? So some of those golf carts have rear facing seats, right? So the kids would be facing backwards while the driver's facing forwards, who's also could be wearing a mask. And therefore, if there were secretions or something, they're going in opposite directions kind of thing. And you're right, the ventilation would be hugely helpful as well. So some of that spacing, facing people in different directions is also very helpful. I had a presentation earlier today and they said, we want to sing at camp. Singing is a cool thing we do at camp. Can we do that? And I said, I will tell you what a camp did this summer. A camp this summer called and said, we want to sing because that's what we do. We love singing. It's part of who we are. And so here's what we decided to do. They took all the people outside, they put them in a big circle, right? So everybody was an arm's length apart. So if everybody spaced their arms out, they're about 6 feet apart from each other. And then what they did, instead of facing everybody in the circle, everybody turned out of the circle and faced out, and they sang facing out of the circle, right? So if they did have respiratory secretions or they weren't wearing a mask or whatever they decided to do, that singing was happening away from everybody. Nobody was facing anybody, and they were 6 feet apart. And they loved it. They loved singing. They loved that they could be outside and do this in a very kind of different way. And they said, it was done out of what we felt was requirement, but our kids loved it. They thought it was the coolest thing to try something new and different that we'd never thought about before. So we've learned a lot of things that the kids have really loved. One of the other big things we've learned this summer is you don't have to have fancy games. You don't have to have fancy camp experiences. They loved just being together. And that meant if you were playing board games and you had to wear your mask, or if you were outside throwing frisbee and the football and you didn't have to wear your mask and you could space out, it didn't really matter. It didn't have to be fancy things. They were just thrilled to be together and just to have some fun and laughs and enjoy one another. And how they came away this summer, some of the camps saying some of the most intimately and emotionally rewarding experiences this past summer they've ever had.
What about some of those face shields that you've seen now that maybe rest on the shoulders and go up, and so people aren't wearing masks, but they're wearing these shields?
Sure. Yeah, I mean, there's a variety of things now. I saw one the other day that just, your eyes are open, but it covers and comes around like this and comes around. It's a plastic shield, just this as well. So people are getting creative, and anything that kind of protects that respiratory secretion is what you're looking for, right? So I don't have data on all those different ones, but I would assume that they are just as good in most cases as a mask. because most of those are even covering a bigger area, right? They're kind of coming around the nose and mouth and face. So can't back it up with evidence, but I would, I think anything where you're providing coverage of those secretions is going to be a reasonable option.
Tracy, do you know about any camps that hosted campers in tents? And if so, how did they deal with it more specifically?
I think there were a few that did tents. And so what the challenge is, if they decided to roll the sides of the tent up for ventilation, then they were a little concerned about critters like the raccoons and the skunks in the camp. So they either elevated their beds, right, a little bit, like, so instead of sleeping on the floor of the tent, they either had some kind of air mattress or elevation, and they tried to create ventilation within that tent, right? Now, some of those tents, if they're really small, they tried to not use the super small tents. But if it's a tent that really normally would sleep 6, then they might put 3 in there and try to make sure there's good ventilation and air movement. Anytime, the cool thing is, anytime somebody talk to somebody about how do we do this, I just start walking through each of those MPIs. Is there a way to do some good hand washing with that? Is there a way to do cohorting? Is there a way to do ventilation and spacing? And what are all the things, right? And so we walk through each of those MPIs. And if we can get an array of NPIs that we can use within a certain context, whether it's intense, whether it's with a particular activity, whether it's with the way we navigate camp, if we can do multiple NPIs for risk mitigation, we feel like that risk goes down pretty significantly. But the key is you got to get everybody to buy in. You're always going to have a few people who say, I don't want to wear a mask. Then camp is probably not the place for you. Thank you for offering to help this year. Give it another year and then come back to see us. But, they just really got to have staff who are willing to buy into being really super great role models.
Which is a great segue into the next question of how did staff deal with keeping up with masks for kids and avoid sharing of masks, and keeping track of belongings is always the challenge at camp.
I don't know that I've talked specifically about keeping up with belongings, but I think people minimized pretty much everything this year, minimized what people brought, minimized, you don't need to bring your blanket and your favorite book and your this and your that and your 12 things from home. Can we minimize some of those extraneous pieces and bring only what you need? And then I haven't heard camps talk about there being an issue with kids sharing a mask, right? Or that kids didn't keep up with the mask, but every camp did masking differently, right? So some camps had kids, if they were there for 5 or 7 days, they required that each child bring 5 to 7 masks, right? This is your mask. You must wear it. It's your responsibility. And so they nobody has given me any insight to say that was a significant issue. If they had disposable masks, then each morning everybody got a new disposable mask. They used it for the day and they threw it away when they went to bed at night. So just thinking about how do you it's got to be an emotional, mental buy-in from everybody in order to come to camp this summer. And I usually talk about it from the experience of share what a day in the life of camp looks like. A day in the life at Camp Sunshine, whatever your camp is called, is going to look like this. When you get up in the morning, you will need to put your mask on and wash your hands and kind of walk them through what a day in the life of camp looks like and say, we need you to sign off on this. We need you to partner with us in this activity and really make it a team approach to make sure that they understand how important their role is in keeping everybody else healthy. It's a great way to teach kids some servant leadership too, right? How we serve one another in a way that promotes our community being healthy and being well throughout the experience. So, if you say, hey, Tracy, if you wear your mask, you're going to help keep Matt healthy. I'm probably going to buy into that, right? Even though Matt is a pretty funny guy. So it's one of those things where you're like, how do we what's that emotional buy-in? What makes us adhere to things that we do, right? Now we're all just wear masks because it's what you do. You get out of the car and you have a mask is just as common as having your car keys. So kids are resilient and then they acclimate much better than we do in most every situation. So you say, this is the rules, these are the game plans to keep us all here and having a great time. I need you to partner with me in this and have a really clear expectation of that, and put it on your website or put it wherever it is that your families go for training and education, and keep reinforcing that need to partner with parents. Another exciting piece that we learned is that parents were beyond thankful this past summer. They were respectful, they were kind, they didn't complain that their child got the spicy chicken instead of the regular chicken at lunchtime. There were no complaints about the trivial things, which is the things you have to historically deal with, is that somebody got chicken instead of something else. But it was just a really nice experience. The nurses were talking about parents were just so kind, so respectful, so appreciative. If we told them we needed something or needed them to pick their kid up early, they just did it. But we're just very, very thrilled to have an opportunity for their children to get to be with others.
Great. We just have a couple more minutes to our hour. If anyone has any last minute questions for Tracy.
I love these last three where they talk about kids wearing masks in school are way better than adults. I'm telling you, your staff is the challenge. Don't worry about your kids. Your staff are your challenge, because the staff that are 18 to 24, and I'm sorry if you're in that age range, have somewhat of an invincibility experience, right? I'm healthy, I'm young, nothing's going to happen to me. And that's probably true in this case. But the grandma at home or the great aunt at home or somebody older than you that you're going to encounter for a brief period of time could become very ill. So the key of this whole COVID experience is, how do we learn to care for the other person more than ourselves? Putting the mask on does nothing for me except to make my nose itchy, right? So really is, how am I caring for the other person more than myself? And we want to teach that concept anyway at camp. We want kids to buy into caring for others at camp. And so I think in a certain way, if you can think of something positive from COVID, that might be it, right? Teaching us to think beyond ourselves, beyond our comfort level, beyond what I want, to how we really care for all those others that are walking alongside us in life.
Wonderful. Well, it looks like there's no other questions in the chat. So thank you, Tracy, so much for spending some time with us and sharing all that information. Super appreciate it.
Well, shout out to Mary Ellen and Teresa. They take care of me all the time too, and I know they're great caretakers of you all. So it's always fun to be with y'all, and we can reconnect sometime. And as more data and information come out, I'm more than glad to share that with you all. I will also send you guys and Jennifer the link to the communicable disease workshop. So if anybody's interested in that in January, we'll be glad to have you as part of that experience.
Perfect. Thank you, Tracy. And then before anybody pops off, we want to make sure that you fill out the attendee survey that Matt's going to launch for us. And then also in the chat, Matt put the link. If you're applying for CEUs, make sure that you complete that evaluation as well.
Tracy, you had this slide deck also that you can email?
Yes, absolutely. Right. Yes, I'll send it to you as soon as I get off here, Jennifer.
Thank you. I'll add it to our conference platform, so if anybody wants to review it, they'll have access to it.
Absolutely. I kind of take some of the data out because the data will change tomorrow and the next day and the next day, and I don't want people to feel like that is what it is, because it will change. It will update as we continue to dive into some of that research.
Yeah. Awesome. Thank you. That was.
You're welcome. Have a good night. Am I the last session? Do y'all get to go to bed now?
Yes.
Well, some of us aren't on that coast, so we get to have dinner now.
Dinner.
I'm going to bed if anyone wants to.
Yeah. And they go have another glass of wine.
I'm like, this is my quitting time.
Well, thank you, everybody, and we'll see you tomorrow for more exciting and informative sessions.
Bye, guys.
Thank you, guys. Bye, Tracy.
Thank you,
Thank
Tracy.
you.